A penile implant lets a man achieve an erection whenever he wants, wherever he wants, and for as long as he wants. Sounds amazing, right? Hello, my name is Dr. Jonathan Clavell. I'm a urologist and penile implant expert in Houston, Texas. If you've been following us, you know how passionate I am about penile implant surgery. But today, I want to flip the script. Instead of telling you why implants can change a man's life, I want to share 5 reasons a man should not get an implant and what solutions might exist in each case. The first reason a man should not get a penile implant is when another treatment option still works, or as I like to say it, never change a winning horse. If you have something that works, for example, medications like Viagra are still giving you a strong erection without major bothersome side effects, then you can very likely hold off from having a surgery. However, if you are not satisfied with the results you are getting with the treatment option, or you are getting side effects from that treatment, then it is very reasonable for you to proceed with penile implant surgery. For example, let's say that injections are still working for you, but you are now noticing scar tissue formation or curvature secondary to Peyronie's disease. Or the pills are working, but you're getting massive headaches or severe sinus symptoms that don't allow you to enjoy the moment. Then it is also reasonable to pursue another avenue. Another example, I have many patients that do not find using a vacuum erection device with a constriction ring or injections to be spontaneous enough for intimacy with their partners. Why? Think about it. For a vacuum pump, men most often need a constriction ring to keep the blood trapped, and while you are going through the motions of sex, it can start deflating. And injections, most of the time, need to be kept refrigerated. They require appropriate dosing to work, and every time we want to perform, we need to take a time out, get the medication, draw it into a syringe, and inject the medication directly into your penis. And with all of these, we need to time ourselves, which can quote unquote kill the mood. They are in some occasions unreliable because sometimes they work and sometimes they don't. Remember, according to the American Urology Association guidelines, which is the biggest urology society in the world, men who fail oral medications, that is men who try and fail Viagra or Cialis, are able to proceed with whatever other treatment option they think is best for them, including the penile implant. The penile implant is not the last resort for the treatment of ED, but if you have something that is working, have minimal side effects, and you are satisfied, you can hold off from surgery. The second reason not to get an implant is when you have urinary symptoms that need improvement. We have 2 scenarios. Number 1, urinary obstruction, and number 2, urinary incontinence. First scenario is urinary obstruction, be it for either a stricture or enlarged prostate. Why is this important? If a man undergoes penile implant surgery and he's not able to urinate after surgery because of an enlarged prostate or a stricture, which is a narrowing of the urethra caused by scar tissue, he will likely require a catheter to be inserted inside his urethra. If by any chance he's not able to urinate for a prolonged period, he will very likely require an indwelling catheter for several days to weeks. And leaving a catheter within the urinary channel that is rubbing against an implant cylinder that is in the corpora will cause both of these to rub against each other and eventually lead to thinning of the tissues and hence increase the risk of erosion, which is when the implant of the cylinder goes inside the urinary channel and then it can develop an infection. Also, performing a surgery for an enlarged prostate, although not impossible, it is easier to perform when there is no implant inside the penis. Does this mean that I cannot get a prostate procedure with a penile implant? Not necessarily. A man can still get a prostate procedure with an implant with minimal risk. It is just easier and less risky to do so without an implant. Does this mean that I cannot get an implant surgery if I have a urinary problem that is chronic and I cannot fix it? Not necessarily either. I have patients who, for example, live with a suprapubic catheter, or they perform intermittent catheterizations for urinary retention or a bladder that is not working properly, and they do well with their implant. However, we need to understand that there is still a risk. The second scenario is urinary incontinence. This is more commonly seen with men after prostate cancer surgery, although there are other types of causes for this. Regardless of the cause, if you are bothered by urinary incontinence, you should at least discuss it with your surgeon to see if there are any treatment options that can be offered prior to proceeding with a penile implant. However, this doesn't mean that a man with incontinence cannot have an implant. Therefore, if you already know you have a prostate or bladder problems, discuss with your surgeon if those should be addressed prior to your implant surgery. The third reason not to get an implant is when you know you have psychogenic erectile dysfunction or severe psychological or relationship issues. If you have deep problems with your partner, an implant is not necessarily going to save your relationship. When us men notice that our function is not at 100%, we start to lose confidence. We start to doubt ourselves, and then it becomes a vicious cycle. When we start having problems with ED, most of us go into the sexual act thinking to ourselves, well, will it happen again? And we start to get anxious, which unfortunately will likely make things worse. Imagine going into battle thinking you might lose. Well, when it comes to sex, a man needs to go into the sexual encounter with the mindset of a conqueror, confident that they will conquer that battle. If you are going into sex thinking you might lose that battle, you will lose that battle. A man who tries to have sex thinking more about his penis rather than the partner or the pleasure that he's experiencing will not be able to maintain an erection. We then go out and seek help. Some go online out of shame and start medications. We start to use non-invasive therapies. Sometimes those work for a while, but then those therapies stop working and we go back into our frustrating cycle of erectile dysfunction. And what started as self-doubt can then end up causing relationship problems. Our partner then starts thinking that we don't love them anymore. They think that we are cheating. Some of us start pushing our partners away. We start shying away from even socializing, all because of erectile dysfunction. And all of what I just described is what we call psychogenic or psychological ED. And this doesn't mean that a man is crazy, but mostly that he's psyching himself out during the act of sex. And if a man has psychogenic ED with normal blood flow in the penis, that man should consider psychotherapy prior to considering an extreme measure like implant surgery. I know of several sex therapists that are great on helping men restoring their erections without having to pursue a surgery. The penile implant is not the last resort, but it is not the first resort either. The fourth reason not to get a penile implant is when a man is a poor surgical candidate. Most men with ED have a physical impairment rather than a psychological impairment, be it diabetes, heart disease, high blood pressure, a previous prostatectomy for prostate cancer, etc., that causes their erectile dysfunction. When we perform any surgery, we always have to evaluate the benefits and the risks. When the risks outweigh the benefits for a surgery, we consider that a patient is a poor surgical candidate. For example, if a man has severe problems with his heart, he might be someone who might want to get his heart treated or at least evaluated first before we perform an elective implant surgery. Or if someone has uncontrolled diabetes, the surgeon will very likely recommend to control the diabetes before we proceed with implant surgery. Even though penile implant surgery is the best option for the treatment of erectile dysfunction, we have to understand that there are risks that can happen with the surgery. And the biggest risk that we fear is infection. Because most of the time when there is an infection, we need to remove the prosthesis. When a man has an active infection near the surgical area or uncontrolled or untreated diabetes, the risk of infection increases significantly. Does that mean that men with diabetes should not get a surgery? Absolutely not. I have personally implanted hundreds of men with diabetes who have had no complications or infections after their surgery. So if you have diabetes and are considering the implant surgery as a solution for your ED, do not be discouraged. Just take action to control your health. Control your diabetes and talk to your surgeon. And if you feel that your diabetes is getting better, but your surgeon still refuses to perform your surgery, remember you can always obtain a second opinion. There are some surgeons that feel more comfortable doing surgery on high-risk patients than others. Remember that being a poor surgical candidate is not always an absolute contraindication, but can sometimes be a delay. Discuss with your surgeon what criteria you need to meet in order to get you to be a good surgical candidate. The fifth reason not to get a penile implant is when a man is unable to operate the device. Remember, a penile implant is a mechanical device. With the inflatable implant, a man has to squeeze a pump inside the scrotum to achieve rigidity and press a release valve to deflate it. For most men, this becomes second nature after a couple of weeks, but there are some situations where this may not be possible. For example, men with severe arthritis, Parkinson's disease, limited hand strength, or neurological conditions may find it difficult to properly activate or deactivate the pump. If a man cannot inflate or deflate the device, then he won't be able to take advantage of the full benefit of the penile implant. Does this mean that a man with hand weakness or disability can never get an implant? Absolutely not. We always have solutions. One option is to consider a malleable or semi-rigid implant. This device does not require pumping, it's bendable, which means the penis can be positioned up for intercourse and down when not in use. It's a great option for men who may not have the dexterity for the inflatable device. Another option is modifications during surgery. For example, placing the pump in a slightly different position that may make it easier for that patient to feel and squeeze that pump. And of course, sometimes physical therapy, occupational therapy, or even a partner's assistance can help a man be successful with the inflatable implant. So yes, if someone cannot operate the device on their own, that is a very important reason to pause before moving forward. But it doesn't mean the dream of restoring intimacy is gone. It simply means we need to individualize the choice of implant to match the man's ability, lifestyle, and goals. In summary, as you saw in today's video, there are 5 important situations where a man might want to delay or reconsider the timing of a penile implant. Number 1, if other treatments still work, like pills, injections, or vacuum devices, without major side effects, there's no urgency to move forward. Remember, don't fix what ain't broken. Number 2, if urinary issues are untreated, such as obstruction from a large prostate or incontinence, those should be managed first to reduce complications in the future. Number 3, if the ED is psychogenic or tied to relationship problems, maybe therapy, not surgery, should be the first step. Number 4, if a man is a poor surgical candidate, for example, uncontrolled diabetes or severe heart disease, medical optimization is needed before surgery. And number 5, if he cannot operate the device due to arthritis, neurological conditions, or hand weakness, then alternative solutions like malleable implants, surgical modifications, or assistance can still help. The key message today is that these are not absolute contraindications. They are rather just situations that may delay surgery or require a different approach. Remember that we want what is best for you. I personally am here to help those who wish to visit us because I am confident that with the right preparation and guidance, most men can still move forward toward implant surgery and the restoration of sexual function and intimacy.